Right. Hey everyone, how are we doing? Yeah. All right, so we're gonna go ahead and get started. I'm Al. I'm the city lead for FaithTech Kansas City. I love that we have several new faces. So I don't think I gotta say hi to everyone yet, but thank you for coming. Catch me afterwards. I'd love to hear more about you, even more than just name that I got from a couple of these. So yeah, so we're gonna start off just a little bit about FaithTech, especially for anyone who's new. And then we'll have Crystal come pray for us, and we'll have Doug doing our main presentation. So FaithTech is a global tech community for Christ. In Kansas City, we meet the second Monday of every month. So the next few months are August, when we're going to talk a little bit about create projects or labs projects. We've got a few different names we've been using, but the idea of using our skills to build things. September is going to be an intentional networking night. And I don't know exactly what that is yet, but it's going to be intentional. And it's also going to be on the networking. There will be some networking too. We'll be on the Mid-America Nazarene University campus, in part because we've been working on serving students and building relationships with them, and we want this to be something that gives them an opportunity to connect with people that have been in industry, been in professional settings. So, and then October, for those that who remember from last October, we did the Perfect Pitch Night, which I think we're going to be able to pull off again this year, again with MNU, the entrepreneurial students. So watch for more information coming on those. The URL, which there would be a QR code here, but the URL changed as of today, as FaithTech launched a brand new design for the website. So faithtech.com, and you can find Kansas City, or come grab me and I'll type the URL for you, for writers. So without more mumbling or babbling, who are we? Why are we here? We're here to meet, to learn, to build. Those are the core tenets and guide our purpose. Yeah, that feeds our purpose and our pillars. A purpose to awaken a Jesus revival in and through tech. It's really easy in all the different tech spaces that we're in to focus on the tech, or it's easy in ministry spaces to focus on Jesus, which is not a bad thing by any means, but it's really hard to bring Jesus into tech. And it's not just about bringing Jesus into tech, but how do we bring revival? How do we lead people to Christ through the tech spaces that we're able to be in? And so what does that look like? It all points back to Jesus. We want to be led by the Spirit. We want to take a sacrificial posture, which I know is hard to hear. We want people over products. Products are great, but people are even better. And we don't want to take ourselves too seriously. Any of you have been around know that I am not formal. I will be silly and ridiculous whenever I can, because that's just who I am. And that's part of why I love the global community of FaithTech. And it is global. One of these days we're going to get a newer map. This one is a year and a half to 2 years old. There are now closer to 50 cities around the world. The online ones have kind of gone through some variation, but I think it's closer to 20 countries. It's 15 to 20 countries now. So this isn't just Kansas City. This isn't just North America. This is all over. I've had the great blessing to meet people not just from the US and Canada, but from Brazil, from several parts in the Mideast, in Europe and Africa, in Asia, in Australia. There's a couple in Australia now too. So yeah, it's part of what's really interesting is if you don't hear something that really engages you from Kansas City, there's other cities doing this too, and they've got really cool stuff going on too. So yeah, and above all, everyone gets to play. I just love this slide. I didn't make this one up, but it goes back to we don't want to take ourselves too seriously. Hopefully at heart, we're all builders, we're creators. We want to produce things for the kingdom. And so our idea of play can look a little different than play does to most people. And that's where that idea comes from. And that's all I have. So Crystal, if you would come up and open us in prayer. That's totally fine.
Jesus, I thank you for all that you're doing, God, through FaithTech in the nations. I thank you for FaithTech and KC. God, I'm asking, God, will you continue to give everyone wisdom and revelation, God, in the knowledge of you? I ask, God, as you, through all that they do, through building tech systems, through finance, through marketing, God, I'm asking, will you continue to speak over hearts today? God, I thank you that you are using, God, everyone here to advance the kingdom of the gospel, God. I thank you that you are doing a good work in and through the nations amongst America, even through the dark seasons, God, where there's so much anxiety and depression, God, amongst our generation, God. We know that you have a beautiful storyline unfolding through the spaces of tech and finance and politics. God, I'm asking, God, will you continue to use us? God, we just ask, God, will you come and speak over hearts today? And we thank you for everyone here asking, God, will you continue to use us in all the spaces that we're in, God, and that you will continue to just bind our hearts together in love for your name's sake. In Jesus' name, amen.
Thank you, Crystal. And Doug, up to you. I'll leave you to have the fun one.
Yeah. Well, thank you very much. So I gave this talk a number of times, and so this is going to be about a 40-minute talk. Feel free to ask questions. Um, so, it's saving lives, saving your life, saving 1 billion lives, and reducing disabilities by 50% with AI. AI is a very powerful tool. So the question is, can we do this? Actually, I gave this talk to a group called Peacemakers and Provocateurs. And So, as I was working, well, what do I want to, I work on AI, and I'll tell a little bit about my background. I thought, what would be my mission around this? And it's to use AI to make the world healthier. There's a lot of things we can do with AI, and then also empower the patient-clinician relationship. So those are things I'm interested in. When I saw this slide, I actually wrote a couple books last year with a medical doctor, Dr. Harvey Castro. This is our second book that was actually published by University of Toronto Press, 2030, A Blueprint for Humanity's Exponential Leap. And so when you're writing a book, you're learning a lot about, even though I've been in this field I worked at Motorola and Nokia for 33 years. In fact, for 22 years, Sprint with my account team. And but as we look at using this technology, how can we use it to help humanity and, use it for the glory of God as Christians, is really important. So, when I look at this slide on how many people will be born, how many people will die. So in the next 8 years, 1 billion people will be born. In the next 14 years, 1 billion people will die. And so in 20 years, about 1.5 billion people will die. The question is how many of those deaths are avoidable? And is it possible to use AI to help avoid avoidable deaths? So, if we really believe that AI is a very powerful tool, how can we use this powerful tool to save 1 billion lives? So that's kind of my goal. So I wrote 2 books. 2030 is our second book. That was actually University of Toronto Press. The first one, Tech-Powered Healing, the Future of Healthcare in the AI Age. So I work in AI. Like I said, I worked at Motorola for Nokia. I'm working on the Sprint team. I also worked on autonomous vehicle technology, which had some AI elements into it. I've also got involved. I was a affiliate faculty on the Kansas University School of Nursing, looking at some AI and immersive learning. So I'm very interested in healthcare, responsible AI. How do we use AI for good and not for harm? So policy, regulations, ethics, governance, road safety. As we're rolling out that, the cyber trucks, the cyber taxis, and so forth. Energy and education. So I wrote 6 of the chapters. There were 3 authors of this book, 2030, and just excited about sharing some of the thoughts that we had, as we were developing this book. So as I'm looking at this, there's been 5 technologies that have saved 1 billion lives. The first one is the toilet. So one of the questions I ask is, when can AI save as many lives as a toilet? So, and then there's fertilizer, blood transfusion, the green revolution, and vaccines. So AI, if we really believe it's a powerful tool, how can, when can it save 1 billion lives? So that's kind of the theme of this. Now, the key thing here is anecdotal information is not meaningful or actionable. They asked the oldest woman, what's your, why, how did you live so long? And she said, sleep and sushi, which sounds pretty good. Then they asked the oldest British man, and he said, cigarettes, whiskey, and wild, wild women. So it's like asking a lottery winner, what's your secret of financial success, right? So, we got to be a little bit careful. You'll hear people throwing out all kinds of statistics. But, the key question is how do we think about our world, especially as Christians, as believers, and, how do we make a world a better place? I was thinking about this quote: a single death is a tragedy, especially if it's someone you love, or is this your death? 1 million or 1 billion deaths is a statistic, right? So, how do we put this at the personal level? And that's why I said saving your life, your loved one's life as well. As I was, I worked in digital health for the last, maybe 15 years on and off. And I really like this quote, which is healthcare is at best a conversation between a doctor and a patient trying to solve a problem. What patients want is to live their lives with minimum impact of illness. I mean, we don't want to be ill. We want to just have not even worry about being ill, and get support and a sense of control. And what doctors want is to practice medicine without a hassle, innovation that makes a difference. If we throw technology at a problem, sometimes the problem is we're throwing technology at it and it's causing more problems than it's worth. So, my how I look at it is to be useful, AI must it must be harnessed to enhance the patient-doctor relationship, not replace it. Improve preventive care and address modified risk factors that lead to chronic diseases and early mortality. So, there's a Greek mythology. They have this guy Tithylus, who was given eternal life. The problem is that he wasn't given eternal youth. So he kept getting older and older, and he wouldn't die, and he just got older and more frail. So we don't, just be more frail. We don't live in poor health. We want to live in good health, and that's our goal. To do this. So in the book, I would have a chapter on history of disease, healthcare, and well-being. And I was talking to a friend of mine who's a Christian, and he said, "See, he talked about Isaiah 65." And where it says, never again will there be an infant who lives but a few days, or an old man who does not live out his years. The one who dies at 100 will be thought as a mere child. The one who fails to reach 100 will be considered accursed. So it's like, okay, how can we have a healthier life? Actually, even here, as people are still dying in Isaiah 65. But so it's not the heaven that we have, but it's how do we live a healthier life? Throughout history, the history of if humanity is the history of death and disease. In fact, during the Roman time, 40 to 50% of children under five died. And up until the 1900s, that was still the case. The good news is that we reduced the mortality, by 2023, only 3.7% of the population, children under 5, die. Though the sad thing is there's still 4.8 million children dying every year under 5. And the thing is if the healthiest countries were the average instead, what that would mean is that would be 4.5 less children dying, because if every child is living as healthy as possible. So, it's like, how can we look at, the statistics and say, how do we live a healthier life? And then the question is, can AI be a tool in the toolbox to help that? It's not going to solve all the problems, but is it a tool that will help? So in writing this, if you look at, like I'm 62, I was talking to a friend, and the question was, well, what's your chance of dying this year? And when I was 60, it was 1.4%, and the females is actually only 0.87%. But as you're 80, your chance of dying in that year is 65%, and then when you're 100, your chance of dying is 36%. So you keep getting older, and as you get older, we expect we're shocked when a child dies, but when a 100-year-old passes away, it's like, oh, he lived a good life, or we expect that. So the question is why do we, why is there disease? How can we minimize the disease state in aging? So the question is, if we can keep aging at the same rate, we don't increase our chances of dying. A 6-year-old would actually live to be, another 71 years alive. And if we could live, have our chance of dying at the same as the 40-year-old, we'd actually live another 263 years. So the question is how do we live? How do we stop the aging process? And there's different people, different groups and organizations looking to how do you lower that death rate, the aging process. We're still going to die, but the thing is how, just like we solve death for the children under 5. In most cases, how do we do that as we're getting older and older? So these are the things. So there in 2021. There was 39 million deaths from the top 10 reasons of people dying, like from strokes, cardiovascular diseases, cancers, and so forth. And so the question would be okay, how could AI help with each of these areas? And so using AI to help with this discussion, we looked at about 3 to 4 million, deaths that could be avoided if we could leverage this tool. Now, right now it's not being leveraged, but if we could leverage it, that's kind of the idea. Now, there's a lot of things we can do already. So like, for instance, loneliness, chronic loneliness is one of the areas that lowers our life expectancy and also our healthy life expectancy. Just like I talked about syphilis, we don't want to just live, longer. We want to live a healthy life. My grandfather actually lived into his 90s, and he was a very strong man. And then he just died, actually in his, at the breakfast table. So that's what we want to do. We want to live very healthy, and then live a good life, and then pass away quickly. So I think most people would want to do it that way. So how can we improve, have our longer life expectancy, but also a healthier life expectancy? And so here are some activities. Like if you don't do any activities, you actually live healthy anywhere from -5 to 10 years less. But if you even walk an hour, a week, you can get an extra 4 to 6 years of healthy life expectancy. So these are some of the things you can do. Golf with and without a golf cart. Smoking, of course, takes down your healthy life expectancy. The other thing I was looking at is, lifelong learner. The Lancet said that there's 14 risk factors, modified risk factors, that could prevent or delay dementia, because we all care about, both our physical health, but also our cognitive health. And so, if you, they like low education. So if you're obviously being a lifelong learner, that will, in fact, 7% is cause of minimizing your chances of getting dementia. Hearing loss. So if you're having hearing loss, you need to get hearing aids, hypertension, and so forth. So I'm not going to go through this whole list, but what I did is I said, okay, if you were a lifelong learner at 70 versus a isolated 70-year-old, how would that? And then I compared that to a 10-year-old, and I said, okay, from a 10-year-old, kids are always they're learning. They're like sponges. They're active. They're social. And so it's like, how can we, as we get older, to be more like a 10-year-old, have this second childhood of learning and excitement and physical activity. So that's kind of like, okay, these are things we can do with or without AI. So I put this poll together, and I asked this group I was talking to, saying, what's the most important thing you could do to improve your health and wellness that you could do but aren't doing? And most people talk about diet and exercise, and these are the things that are really difficult to do. And the question is, can you have can you look at 5 things that you can do to improve your health, and how can you get those and how do you track that? And again, that's something AI can do as well for that. So one thing, and Steph was talking about her experience too, is she had, and you want to just describe what you had just real quick?
Sure. So
yeah.
Thursday night, I opted to mow my yard instead of going to the grocery store, and I had to wipe my sweat off, stop the mower, and a couple seconds later, with pants on, I felt a sting, a bite, and something that was like took my breath away. I think I stood in the yard shocked, felt a ton of pain, but I didn't know what had happened. So I went inside because I love my chat GPT, and I took a picture and I sent it, and I started a conversation for very quick medical intervention of what just happened, didn't know what caused it, knew I was in excruciating pain, already had swelling, already had redness, could see a spot. So it guided me through what to do next.
And that's health literacy is absolutely critical. Yeah, in fact, I could ask as Chat GPT gets to know, or your AI assistants get to know you, it's like, what are the 5 to 10 things that you can do to improve your health? Like I had an eye infection, and so I asked the doctor, okay, what was that eye infection? And they recommended a certain medication, and then they said, okay, it could be an autoimmune disease. So I wanted to get some more information. I wanted to have, so when I could talk to a doctor or my clinician, I can say, okay, what is appropriate, so I get a little bit more education. So when I go to the doctor, I can ask questions, or when they're talking to me, I can, if they say something, it's like, oh, this is something I should pay attention to. The key thing is getting that guidance from a medical doctor or a nurse, because they talk about a lawyer or a person who represents himself as a fool for a client. It's very important that we have a professional for certain things to make sure, if it's minor, yeah, maybe we don't need that, but making sure that, ask your doctor for guidance as you're trying to figure out, as a guide, right? Is a partnership between your doctor, your nurse, and the AI. So it should be enhance that relationship, not replace it. So I was asking Chat GPT, okay, what are the 5 things for me to focus on? I have a sweet tooth, so it's like sugar. I need to watch my diet. Sleep is very important. So as you get older, absolutely sleep is important. So what are good sleep hygienes to do? Stretching, strength training, exercising right, socialization, spiritualization. Are we, we're spiritual beings, we're social beings. We need to really focus on that. And then soreness. For me, I sometimes play too much tennis, and that I can cause pain or too much harm to my body. But for my mom, I was thinking, okay, what's the 5 things my mom should be focusing on? My brother, myself, and my sister are caregivers for my mom, and for hers, medications, making sure she's not taking too much medication, but the right medication. Meals or diet, she doesn't eat enough. Movement, motion is lotion. Mental and memories and mental stimulation and rest, exercising her brain, but getting to sleep, and then meaningful relationships, people to love and to be loved, and family connections. But for each of us, we have, what did you think about? What are your 5 things? And if you have an AI solution, it's like, okay, what should I be focusing on? Is it diet? Is it medication? You can put your medical information into Chat GPT. I would say make it so it's not trained, so it doesn't go outside of the, it's only isolated to you. But those are things you can do to get a better understanding of this technology. I mentioned sleep, and absolutely, this is one of the problems that AI can actually cause you not to sleep. If you're constantly looking at AI, I need to make sure I'm, by 9 o'clock, I'm starting to turn off my brain and just resting, because if you sleep only 5 hours a night instead of 7 hours a night on average, it will take away 3 years of life. So, it's really important that, especially as we get older, that we're focusing on good sleep hygiene. Another area, and actually my friend, Dr. Harvey Castro, he's working on fall detection, not only detection, but prevention. And, 3 million older adults go to the emergency room every year, actually more than car accidents. And more people die in the United States from falling than they do from car accidents. So, how can AI help with that? Is medication review, making sure you're not taking too much medication, checking your blood sugar. If your blood pressure is too low, that's a problem. I'm really excited that I think in the next 5 years, we're going to have smartwatches with blood pressure on it, as well as blood sugar. And so that should help a lot. And then, strength and balancing, and then safety assessment. So, these are the things that can help improve, the risk of falling. So again, how to avoid these avoidable deaths. The other one is the one I struggle with too, is obesity. Where we have this unlimited food, and the question is making sure we eat right, and so that's another area to focus on. Unfortunately, the reward centers of food is we want to keep eating and eating, and so we just really need to work on that. Is something I'm struggling with, so that's an area. So my call to action. in looking at this is AI literacy and health literacy, is that the more health literacy you have, it adds an extra 3 to 5 years of life. It adds an extra 6 to 8 years of healthy life to you. In fact, one of the other studies they said is the life expectancy of the richest and the poorest is 10 years. Healthy life expectancy is 20 years, this one doctor said. So, how do we make sure that, we have good health literacy? And I believe, if you don't understand what the doctor tells you to do, you can say, okay, explain this to me as if I'm in fifth grade reading level or ninth grade reading level, or, go back and forth and keep asking questions until you understand, you have a really good understanding of your health condition and what you need to do. In fact, I was talking to my friend, Dr. Castro, and I said, when you're talking to the doctor at the end of your visit, the doctor comes in and says, okay, you should do this, 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 and this. And what does the doctor say? Do you understand? And what do you say? Yes, because you're not going to say, no, I don't understand. The better question a doctor should say is, okay, given this information, what's the one thing you're going to do to follow this treatment plan? So that's the important thing. Personal AI agency with AI. In fact, I was showing that video earlier before the start, that it's the future of aging in place, and how can we have it to make sure that we have robots and monitors and devices to make sure that people age in place responsibly, but at the same time don't lose that human touch. So that's really important as well. And then reducing medical errors. This is, if I was giving a talk to the doctors, I'll talk about this. But unfortunately, there's 12 million people are affected by diagnostic errors. Because like, okay, I have some issue going on. The first, before I can treat it, I need to know what it is. And so there's 12 million affected diagnostic errors in the United States. 4 million people are harmed, and 2 million people are affected by medical errors. 250,000 people are harmed. So, the question is how can we make sure that we're getting the best care possible, and AI can play a role in that as well. So, making the best health decisions with the aid of AI, solving how the body can fails one life at a time before it fails. According to Dr. Atul Gawande, there's 13,000 ways the body to diagnose, or the ways the bodies can fail. There's 6,000 drugs, 4,000 medications. And so the question is what is the right treatment for you, and what can maximize your health? So these are the challenges that we're facing. So I showed that video earlier, but it's kind of one of the things I think is really important, and that's why I showed that slide of the healthy, for dementia, is can you be a lifelong learner? So the difference between, and I like this quote from the video: life never really stops, because life never stops teaching. No one knows what the world will look like in 30 years. Definitely something more amazing than we've ever got now. No matter what, though, I know when it's my turn to make the world work, I'll be ready. So that's what a lifelong learner is about. That quote was actually, and so here I created a video on VO on this lifelong learning. So especially as we're getting older, we need to be lifelong learners. So same way with this is the young, where you have, education of young people with having digital personal assistants as well. So, please, if anyone has questions, because I got about another 10 minutes. But one thing is, because of COVID, healthy life expectancy dropped dramatically. It used to be 66. The average person stopped being healthy in the United States at 66. It's now 63.9 years. And we'll see if after, if we recover from COVID, because the data isn't past 2021 or 2022, excuse me. But we'll see where it goes. But unfortunately, healthy life expectancy has dropped. Not only are we dying earlier, but we're less healthy. So I believe that humanity's quest to save 1 billion lives using AI. I think that 1 million lives could be saved using this technology. Again, this is a very powerful tool. AI. I think you're going to have AI healthcare robot assistants by 2033, maybe earlier, but I think by that time we'll start seeing that more and more. We'll have 1 billion people using AI healthcare to reduce medical errors. by 2033. And then 10 million lives I think could be saved by 2040. Traffic accidents, 1.2 million people a year die right now from traffic accidents. And I think we could get that reduced by 1 million lives a year could be saved by 2043. And then 1 billion lives saved this century, and maybe by 2050. So the question is, we save your life or a life of a loved one with this technology? So that's what I'm hoping to be working on. Also, there's 1 billion people that have disabilities in this planet. And so can we use this technology to reduce disabilities by at least 5%, and then by 25% by 2040? So not only do we want to live longer, but we want to live healthier lives. And so this is, where the focus I'm focusing on and working on. Just wanted to highlight, we do have an AI club where we're looking at using this technology. We're actually it was a sold out event, but it's at UCode tomorrow. And then in August, every month they're having an event. So, but one thing we're doing here is we're kind of tying in between universities and trade schools with the AI community here in Kansas City. So we're trying to encourage young people who are interested in AI to promote this, to help them find the appropriate jobs as well. Interesting, the Kauffman Foundation, they are doing a $100 million grant. They've awarded right now $3 million to 6 organizations for planning. But it's to help young people with college and access and completion, then workforce development, and then entrepreneurship. And I believe AI can help with that. And hopefully, a big part of this area is in healthcare. And so I think the strategies around AI in healthcare could be huge. So I'll close with this topic, which is, Peter Diamandis. He's a futurist, and he's really promoting healthier lifespan. And he asked the question is, what would you do for 30 years of healthy life? So he's with a group of people. They established this X Prize Health Span. Health Span is healthy lifespan, and it's $101 million. And so they've already awarded $10 million to 40 teams that they selected. It went from 640 teams down to 40. They got $250,000. And then next year, they're going to select a team of 10 finalists. Now, even if you don't make the semifinals or the finalists, you can still compete. But the idea is that you're going to take people in their 50s to their 80s and see if you can reverse their aging by up to 20 years on muscle, immune system, and cognitive health. And it's with a single treatment over a year. And then they'll measure it in over 7-year time. So the question is, can we improve healthy lifespan over the next 5 to 10 years? And I think this is a little bit more aggressive than I personally don't know if this is going to occur. But there's a lot of things we can do in the short term. Like I said, some of our lifestyle choices, as the technology, as AI is being worked on, and using AI as a tool, again, to get better healthcare access as well. So here are the different solutions. There's drugs, devices to do monitoring, gene therapies, nutritional, repurposed drugs, small cell, stem cell therapies. So we'll see what goes on, but there's a lot of research going into this space. So I'm really excited about, where could this technology go? They did an analysis, because our world, there's a lot of opportunity for abundance, but there's still a lot of scarcity. The thing is, if we can improve healthy lifespan by just 1 year of people around the world, that would gain $38 trillion of the economy. So what could we do, as we gain, 5 years or 10 years? So that is our goal. Unfortunately, with COVID, we actually went in the wrong direction with COVID. The question is, can we use this technology to live healthier lives? So with that, I'm going to close, and then open it up to questions. So, yeah, please.
I'm simple. I just thinking through it. You talked about saved lives. How do you quantify saved lives? You like put it 6 more months than if you didn't have intervention? Is that what you're considering saved, or is it a year, or is it how much longer does someone have to live for a saved life to be considered a saved life?
Right. Well, like I had a friend who had chronic myelogenous leukemia, and her expected life expectancy was going to be 5 years. But with this new drug called Gleevec, she now has the same life expectancy as a normal person her age. So that basically gave her 15 years of healthy life span.
The idea is, say average lifespan was, a healthy lifespan was 65 and total lifespan was 75. You would consider like a saved life to be somebody who could reach the average healthy and total lifespans because of intervention.
Right. Like for instance, if you're not walking, if you're not exercising, on average, you're going to live an extra 7 years longer. You're going to live an extra 7 years healthier life longer. So, it's two things. You want to be healthier and live longer, right?
But I mean, how much longer do you need to live and how much longer do you need to live healthy? To hit like the stature of having it, like you got the 1 million life saved, but is it saved in the sense that they live another year, or is it that they live to the average?
Well, if they were not going to, without the intervention, they were going to die in 3 years and they're going to be in chronic pain, but with this intervention, now they're going to live an extra 5 years healthier and maybe 7 years longer. You're right. So the question is what can I do today? Like, for instance, going back to this, dementia chart, if, how can I, like for instance, if I start reading, I start becoming more lifelong learner, I reduce my risk of dementia by 7%. If I have hearing loss and I get a hearing aid, that's an 8% risk of reduction. If I stop smoking, it's a 5% risk of reduction. If I start exercising, that's a 2%. I'm lowering my risk of getting dementia.
And that's like the next year. Is that like over the next year? Or that?
Well, it's of in your lifetime, in your lifespan, right? If like my risk right now, let's say it's 14% chance I'll get dementia, but if I do all these things, it will reduce my risk by 40 to 50%.
If I had a car accident on the way home, my risk of a lot of chronic illness goes zero for my life because
Right.
I got a master's in statistics, so I ask questions because
No, that does.
I'm like, what does it really mean for our million saved lives? Is it that you lived an additional year than you would have without the intervention, or is it towards a median health span? So that's the thing that on those stats I was interested in on the goals.
Right. Like according to if you go to the Social Security table, you can look at your age, and they'll say when the likelihood for your age, if you're male or female, are you likely to how much longer will you live? And the question now, if you're in hospice right now, it's likely even if the statistic says you're on average you're going to live 20 more years, you could die, or you could get hit by a bus today and you're dead, right? But then there's going to be other people that the average is 20 years, but you could live 40 years. Yeah, go ahead.
Talking about the AI intervention, especially as it goes to healthcare, I'm curious, do you see that? So in practice, do you see that as sort of a top down where your doctor has an AI agent that's working on your behalf, or do you see that more as a bottom up where you have your own agent that helps you monitor and then you provide that information to your doctor?
Yeah, well, it's both, right?
Okay.
Yeah. So the top down is you're getting better, or so bottom up in an individual, you're having better health literacy. You understand your health. You understand, each of us have individual needs. You may take medication, you may not. And so at an individual level, it's bottom up. But then you get AI to give you guidance from, because you're not an expert in health, right? But then there's top down, which is, okay, there's a lot of medical errors happening. According to the World Health Organization, 3 million people die every year for unsafe medical treatment. 50% is medication here, by the way. So, the question is can AI kind of follow, the key question is, am I getting the best care possible? So there's two things, right? As an individual, what can I do to be as healthy as possible at my individual level? And then also from a public health perspective, am I getting the best care possible given my condition, right? And I can't answer that. A medical professional has to answer that. But can AI guide that as well? Yeah.
So on the personal agency side of things, from a product development perspective, how do you address the challenge of building an agent and with respect to liability? Because you're talking about things that potentially give a person a lot more information. I wonder if it's not analogous to our problem with full driving mode, where our expectation is that we're going to have 100% reduction in accidents. And with, a serial experiment down in Texas didn't quite build that. So how do you get around that, the whole issue of public liability, so that someone is incentive to actually build something?
Right. And that's the challenge, right? Because at the end of the day, who has the liability? Like if you get into right now, if you go into a Tesla full self-driving, the driver is still liable for everything. If you go into a Waymo, which is self-driving, there's level 4, and Waymo has a liability. So the question is you're making health decisions, who has that liability? And this is going to be the challenge, especially like, in the medical professionals, before they bring in an AI tool into the hospital system, they vet it to make sure this is going to be, it's going to be safe and effective.
An institutional standard or the tool that a company would use to build a product. I think there's safeguards there, but for an individual to sit down, I saw a lot, had an injury recently, and he was consulting AI, and he came up with some particular solution, which I don't think is the right one, I guess. But I'd like to do a visit a doctor then.
Right. I mean, that's the fundamental question that's why we should go to our doctor still and ask for, get their guidance on this. But you can say, okay, I looked at my blood work, like in fact, I recently had blood tests, and there were 2 tests that I had never had before. So I put them into ChatGPT and said, okay, what is this? The good news is it was in range, and actually it was on the low end. But I was not aware of those tests, and so I wanted to get some education. I wanted to have higher medical literacy to know about that. And for my mom, I'm checking that constantly because actually one of the questions I asked this group when I had a little bit more time is, when did medical technology or the doctor save your life or a life of a loved one? Right? We have all stories of, wow, like even my condition, I was in a lot of pain. And I went to the doctor and they put a drop in and it just took the pain completely away. It was like night and day difference. So, that's when, it's like, wow, this is a miracle drug. And my friend had chronic myelogenous leukemia, again, it saved lives. But then unfortunately, like my mom, she was in the emergency room 4 times, turned out to be kidney stones. And her blood, actually, one time she had to go to the emergency room before her surgery because her sodium was too low, even though for 3 other visits to the emergency room, her sodium was too low. It's like, I saw it. I was looking at her my charts and I was like, okay, that's too low, but, I'm not a medical professional. I guess it's not a big deal. And then they said, you got to come into to the emergency room to get the sodium before you can do this surgery. So, making sure, and now, when I look at my mom, we were giving her calcium pills and then her calcium was a little bit too high. And so it's like, okay, we got to stop that, So, can we get information to make good healthcare decisions on a daily basis is the fundamental question. But again, you have to then in partnership with the medical professionals who have 20 years of experience, right? It's like my medical Googling of 5 minutes isn't equal with your, the 20 years of experience. Yeah. Does anyone else have a question?
I've got another.
Yeah.
So, and I know you're not a medical doctor, but in your experience working with doctors, do you anticipate that through AI we would be able to get more personalized medication dosages? I think you mentioned your mother, her calcium was too high.
Right.
I wonder if we, because it seems like we're throughout history, when we've given prescriptions, it's been sort of these ranges, right? It's like take 100 milligrams of this,
Right.
this many times a day. But I wonder if it's, maybe it should be like take 80 milligrams of this or take 102 milligrams of this, right? So we
Right.
can get more specialized for each individual person rather than a broad population of people. Say, well, we think everybody generally should take this amount, and that might not be the right amount.
Right, yeah, each individual, and that's why, like each medication. In fact, I was talking to one person, his I think it's either mother or father was taking 18 different prescription drugs. And it's like one drug was counteracting the other drug. And he's like, finally, like, okay, what are 3 drugs to take? Because one of the, going back to falls, so one of the big risk of fallings is taking too much medication. You're dizzy, Yeah, I mean, if you took 18 pills, even if you're very healthy, you'd be falling all the time too. So it's like, how can an 80-year-old who's taking 18 pills not fall? Is the question. It's just kind of like getting drunk, is almost equivalent. So, we need to really be careful that we're not over medicating people, or having too much, we want their blood pressure to be low, but if it's too low, then you're more likely to faint
Do
and
you think
fall.
we're close to maybe that, or are we still a few years out from?
I was hoping like in 2015, like with Internet of Things. In fact, I have a longer presentation. Nokia had an X Prize for $2 million for the Nokia Sensor Prize. Qualcomm had a $10 million tricorder X Prize to look at this. Like the Apple Watch, they now have heart rate, blood oxygen level. So we're getting stuff. I think the 2 that will really make a difference could be blood sugar. Already you have the patch, but that's $100 a month. And the other one is blood pressure. If we can get those 2, I think that could go a long ways to making better decisions.
I think one of a lot of people wear a glucose monitor. I can take a monitor, so I can tell you exactly what my glucose is. Unfortunately, it doesn't talk to anything else. So it'd be nice in this Internet of Things world to have all these devices talking to each other. Then I think you could have a consolidated. You could AI very helpful.
Right.
So I've seen some bad here. You would have tested it's looking at all the individual devices.
Yeah, like what, if this food is causing you to spike your blood sugar and so forth.
Yeah, I think from the perspective that there's probably 3 fundamental groups of people when it comes to health. Those, no matter what they have available for information, just won't care.
Mm-hmm.
Those will do everything in their power to, figure out, sort out what these studies really mean and try to figure out. And then there's probably a substantial chunk where it's like, if it wasn't that much work and I didn't have to have a PhD, is that really the group that you're hoping should benefit most from this? And I think the one group which isn't going to care until they're in the emergency room, it's just all the information in the world. This isn't going to matter. They're just
Well, what happens is someone doesn't care until they are so sick that they care, but then how do we treat them, right? And that's one of the challenges. But the question is that health literacy, can we give them, gentle nudges? The problem is this a nagging AI nanny that just nags you, and we don't want that, right? It's like, how do we get the information that is actionable, but it's not overwhelming?
I mean, like, how do you incentivize, how can you use this to incentivize, help those who are gonna be seeking help for the sake of seeking help, they have that. But how do you, but I think the big, from a cost standpoint, just thinking in terms of our overall cost standpoint.
Mm-hmm.
And the fact that, well, increasingly, when you look at budgets and you look at Medicaid and Medicare, and you look at all the fighting going on politically about. What are your thoughts on how you could help incentivize those who just don't care or don't really think it's enough of an issue? Take advantage of this to realize, little small, not too hard to make changes now can have these massive ramifications later. And I don't have an answer to that, but all this thing, I assume you've made some thoughts.
Yeah, I mean, one of my concerns is like 60% of young women are getting their medical advice from TikTok. So and you're following that. So are we, how do we vet the information? This goes back to critical thinking.
Is that like where did you get that statistic?
What's that?
Where do you get that statistic? Like, how can you know?
Yeah, I mean, I have the source for the statistic if you want it, but it's, yeah, 60% of young women to get medical advice from TikTok.
What are the ages?
I'd have to pull it up, but yeah. So that goes to critical thinking. Are we, because like most of us, like if something's going on, it's like, oh, did you have this, I have this thing going on. What would you recommend? Right. We talk with our peer friends.
It's the age-old problem that, I mean, even before AI, it was always there where people know what's good for them, or they know that what they're doing isn't good for
Yeah.
them, but they're not gonna comply. So compliance is always a big issue.
Yeah.
But I was wondering, how does this, since this is like the FaithTech,
Right.
meaning, how does this align with like spirituality in the terms of like, I think AI is really exciting from a product standpoint, because now you have all these consumers who are dependent on your product, whether it's pharmaceuticals or some kind of bionic edition or some kind of monitoring, right? So there's subscription models, all those kind of exciting things from a financial standpoint. I'm wondering, like, as far as like there's also the tendency that he brought up about the offloading of the responsibility, right? Like now it's, oh, that's not my fault. That's the AI did that. So there's that issue.
Mhm.
And then there's the other issue of, in terms of the spiritual side of AI, is like, we look to AI, that's the answer to life. That's the answer for you living longer. So how do you see that, like that intersection of, of your vision for that end?
Well, I guess the first thing, and this is the slide, is saying AI is a tool, not a person with emotions or a God. I hear about that. God created the heavens and the earth, right? And thinking that AI is a God is like a 2-year-old thinking that they're like their parents, or even more like bacteria is like a human, right? So, this is a powerful tool. Let's use it right. That's why, saying, hey, there's you can get health literacy, but then check with your medical professional to make sure you're, especially, the good AI tools, when things are going wrong, they say, okay, but at the same time, if you're having shortness of breath, if you're dizzy, go to the emergency room, right? Yeah, go ahead.
How much of this type of a debate do we see centered in the privileged North America versus other populations, where populations, they would love to know how unhealthy they are and do something about it.
Mhm.
They haven't had access to that type of knowledge.
Mhm.
And so I think part of it is, my God is the God of the entire universe, of
Uh-huh.
all humans. And I feel it can be very easy for us to have our biases because of our own life
Mhm.
and all the access that we have, but we forget how amazing this type of tool, the questions that can get answered to people that have had no access.
Mhm.
So, I think when you think of this being excellent for humanity, I think that I choose to look through it at a couple different lenses and make sure that I don't put my own biases on a person that has access to knowledge that just doesn't choose to use it. And trust me, like, one of my best friends has her Aura and she stopped wearing it
Mhm.
because it told her all the things she didn't want it to tell, and it stressed her out more. And so she just stopped wearing it. Her daughters are, Mom, okay, if it's telling you that, then what do we want to do with that? Right. So at least it created conversations.
Mhm.
I think God wants us to live healthy, good lives,
Mhm.
and not just those of us that know, like, give everyone the opportunity to know.
Mhm.
And I think that that's a really powerful way with AI. AI is creating access
Mhm.
for all, if we help the leaders get it to them, right? We make sure that
Right.
everyone has access.
Yeah, like
I think that some of these, when we look at them and we get to have these conversations where we live and worship, are very different through our lens than other populations.
Yeah.
But
That's a
just
great
to what
point.
end, right? Because, I mean, if you look at biblical passage, people live hundreds of years,
Right.
but God, because of our sinful nature and
Right.
desires, right? He limited that. So, I guess it's a wrestling, right, with those kinds of questions. And I think that's why AI brings those kinds of questions
Mhm.
up,
Right.
because it's exciting from one point. There's also pitfalls as well. So I think it's a
And
conversation.
if I could add another
Sure,
comment,
please.
Doug invited me into a group with Harvey, and he had shared, some of the information back about bedside manner of physicians, and that the care and that was provided in that manner from AI was preferred and appreciated and superior than that of a human. So I feel like as a believer and as a sinner, could we look in the mirror a little bit and go, wow, the human skills are human skills. Like, are we compassionate? Do we use our critical thinking skills? Are we curious? Are we creative? Did we lose that somewhere along the way? Right. And I have found in my own just exploration and curiosity and getting to be a part of these type of conversations. And that book, everyone in here, I hope, has read it or is going to, or listen to it. It's amazing. It's a catalyst for so much more learning. I just think that that's a very interesting opportunity for us as people to go, oh, well, if if AI is doing if AI is doing human better than humans are, that's not AI's fault. That's humans' fault.
Mhm.
And that gives us an opportunity to look at it.
Yeah, I mean, one thing is especially secular people, he said, well, we'll overpopulate the world if everyone lives a little bit longer. And, I think of this as a Scrooge approach, right? If they would rather die, let them die, and because they are unhealthy, right? And so it's like, how do we live a healthier life? And the story of Scrooge is because he changed, Tiny Tim lived. In fact, going back to this, Tiny Tim was ready to die, and because Scrooge changed his life, he then helped save Tiny Tim's life. And so, I like the end of the Christmas Carol, because he became as good a friend and as good a master, and as good as man as the old city knew. Because he changed, he was able to change other people's lives. And that's the message of Christianity, right? Is that we want to change lives. Will we be able to end death? No, we're all going to die. But how can we live as healthy as possible and help people live a healthy life? And what are the tools that we can have? I guess the one last thing is when I worked for Motorola, we went from 1 billion people having, actually, when I started with Motorola, there were 7 million people using cell phones on the planet. It went to 1 billion people. And now when I left Motorola, Nokia, it was 5.2 billion people had smartphones. And today it's like 5.8 billion people having smartphones. So, we can, have abundance to a lot of people with this technology. Yeah.
But the thought, with respect to just simply increasing not only morbidity or reducing morbidity, increasing length of life, in one sense, strikes me as a bit of a Tower of Babel pursuit, if that is its only goal. I think there's an opportunity, though, as we think about, as believers, think about what would I do with longer life, to begin crafting into our definition of healthy some concept of our place in relationship to God and all that. So hopefully the solutions that we would come up with, that we're taking a broader view of what is helping.
Absolutely. Yeah. In fact, like on a talk I give on hallucination, one of the slides that shows how can the church be authentic in this AI age. And I heard a quote by Nora Jones, who said the church should be a place for authentic relationships. So, AI can have this artificial intimacy. We as Christians need to have authentic relationships and understand how to use these tools properly, But you know, at the end, you know, how do we use them when we have as a personal relationship and not, and use it as a tool that doesn't harm, but to help people. Go ahead.
I have a question. So, like, in your spaces now, do you see like the medical doctors, like med schools? Do you see people utilizing AI now, or like, how does this look like in the med school?
Yeah.
Students like 10 years down, 15 years down.
Yeah, I mean, there's a lot of experiments, but like, you know, in fact, I could show, I don't think I have it in this deck, but of how medical professionals are using AI. Right now, you know, like right now, a doctor, if you go to your doctor, they spend 2/3 of their time looking at the screen, only 1/3 of the time looking at you. And, you know, it needs to be flipped. So what they're actually using is where they have dictation, where the, you know, as the doctor is talking to the patient, is capturing all that conversation and it's loading that into the electronic medical record. So the doctor, only after the visit, the doctor just goes in and checks to make sure the AI did the updating the information properly. So dictation and updating the electronic medical record is going to be something that will really help, that so that the patient is focusing on, or the clinician is focusing on the patient and not the screen. You know, so I you know, there's that, you know, like Kansas KU Med School, they have an AI working group for the medical students on how to integrate this. You know, the good news is there's a lot of you know, doctors that are creating patents on our AI to say, how do I integrate AI into my practice? You know, there's lots of innovation going on in medicine.
So you see like the big health systems like using.
They're trying to figure it out. The problem is a lot of times technology increases costs, doesn't decrease costs. You know, that's gonna be the dilemma. Yeah.
I think you might touch on this a little bit. You know, I think there's still a lot of gatekeeping right now in with AI, in that, you know, because everyone's trying to monetize it,
Mm-hmm.
that there's, you know, that's how you monetize it, is you control the access to it.
Mm-hmm.
And so at some point, I would hope that the AI becomes prevalent enough where there's just not any value in keeping access to it, right? And then it becomes more,
Yeah.
you know, more open source that we see, and then we can see, you know, medical systems start to, like Epic and Oracle and different things like that, can start to talk to each other.
Exactly. Yeah.
For me, I mean, right now, like in the US, if it doesn't make insurance companies more money, or it doesn't save the US government more money, how much practical reality you think there'll be in adoption? Because basically everything I see at this point comes down to, if you can make the medical office, the medical practice that was once owned by the doctors, but now it's owned by a private equity company. There'll be insurance that has to occur, unless these folks see this as actually making them money. How do you approach this where people can make money? Because that's what will motivate the people that have primary decision choices.
Mm-hmm.
In terms of, well, we might recommend this drug, but it's a lot more expensive, so we're not gonna recommend this drug explicitly because it's not. It might make their life better from a moral standpoint, a health standpoint, but it's not something that we think we will justify from insurance, because this drug is $20 and this one's $100 a month. I mean, what are your thoughts on how to deal with that? I'll call it an ethical issue, in my opinion, that the decisions now, even when you know better, aren't being adhered to because they're seen as a sufficiently non-profit, but the profit motive isn't there.
Yeah, I guess what I look at is, you know, like if a drug, you know, is prescribed, it's like, okay, you know, ask, is there a generic that's, you know, the same, that's cheaper, that is effective, right? I do think, like right now, there's 1 billion people that go to the emergency, or excuse me, they have a doctor's visit. There's 1 billion doctor's visits a year. And how many of those could be handled with telemedicine and then eventually AI? And, you know, like right now, you know, AI nursing for education, rather than paying $70 an hour, and having nurses that they're burned out right now. So can you have the offload of the difficult jobs, jobs that aren't that interesting to the AI, so the nurses could do the things more creative and the things they more enjoy. So I do think that in the long run, the cost of care could get less. Also, as patients, as we trying to figure out, okay, right, you might have thought about going to the emergency room or urgent care, but because you said, okay, what should the 5 things I should do? I don't know if anyone's used WebMD, but I found that pretty, and I'm pretty good with searching. It's just like it's I don't find it very useful when I have something, but I find Chat GPT, especially there's my Dr. Castro did a GPT specifically for health information engagement. I found that very useful, and it gives some really good insights to so that I can do self-care for the things that maybe I would have gone to urgent care before.
I think, I'm in the group that will look at this and then we'll try to validate from other sources. But again, I keep coming back to the perspective of having different debates with folks on different parts of the political spectrum and both believers and non-believers.
Mhm.
But to me, it's like the low-hanging fruit is a lot of the people who don't really care. They're like, I'm just trying to survive till tomorrow. I'm trying to, how can you make it so cheap and so easy? Or even like one debate I had was, well, you ought to probably figure out if you can monitor enough of their health metrics and then pay them some money, give them a new iPhone every year if they actually meet these goals, because it will be cheaper to do that than cover their Medicaid costs when they're disabled and can't work at age 40.
Right.
And so I kind of keep coming back to some of those things in terms of there's what the willing will do, but a lot of our cost, and then the fact that when you have that much cost for those who aren't caring, when those who are caring can't afford anything because overall insurance companies and, whether it's the federal government or the state government or so that's my thought is how do you take that angle of people will adopt it when it saves them money and there's a.
Yeah, I mean, that's a challenge with healthcare in general. It's that, we don't spend money on our healthcare. We expect the government to spend money on our healthcare. So, it's like, but what can we do to be healthier? As an individual, what can we do to be healthier? As a society, how do we help others to be as healthy as possible? As Christians, we want to help heal the poor. And so, but we want to do it in a humane way, and not just throw technology at a person. But I don't want a robot. Even if I have technology for my mom, I still need to be calling her 2 times a day. So this is our challenges. So with that, I think we should close, and I'm happy to have follow-up questions and still be around for a while.
Thank you so much.
Thank you so much.